Good day everyone! We are here to report about drugs and drugs abuse. So we all know that drugs is a prevalent problem here in the Philippines, right? And we can collectively agree that this can be considered as the menace of the society. Being a victim of drug abuse would already be considered a losing game for your life, as this wouldn't only let you lose the trust of your loved ones, but you will also lose yourself and your mind. Also, drugs will influence the innocent people around you. So now, let us know what is it in drugs and why a lot of people are addicted to it. A drug is a chemical substance used as medicine or in making medicines which affects the body and mind and has potential for abuse. Without an advice or a prescription from a physician, drugs can be harmful to everyone. So there are two forms of drugs. One is the natural and second is the synthetic or artificial. So the natural drugs include natural plant leaves, flowering tops, resin, hashish, opium, and marijuana, while synthetic drugs are produced by clandestine laboratories, which include those drugs that are controlled by law because they are used in medical practice.
Thank you for that information, Miss Mika. Now let's move on to the next topic. So drug has both pros and cons. Under the pros is that it can help people achieve the desired medical outcome through making people's minds and bodies function better during an illness. If and only if these drugs are taken correctly and seriously with the doctor's written order known as the prescription. Under the prescription, the physician indicates the directions such as the dosage and the duration on taking the medicine. On the contrary, if you are taking drugs without proper medical supervision, then you are practicing drug abuse. Under the cons of taking drugs is number 1, it can worsen one's illnesses, especially if you are taking the wrong drug or the wrong amount of drug. Number 2, it can destroy blood cells. Number 3, it can damage the body. And number 4, it may cause death. So to avoid these problems to happen, make sure to see a doctor before taking any medicine.
Prescription drugs are medication that can only be obtained with a written prescription from a licensed healthcare professional such as the doctor or a nurse practitioner. Examples of these prescribed drugs are antibiotics such as amoxicillin, pain relievers like oxycodone, and antidepressants such as fluoxetine. The use of prescription drugs should be carefully managed and monitored to ensure their safe and appropriate use. This type of drug also requires special oversight because they have potential risks if not used properly, such as being diverted for illegal use or misused in ways that deviate from the intended use outlined in the medication's information leaflet. And these are prescribed according to age, weight, height, and condition of the individual patient. In terms of the dosage and duration of use, they should be tailored to the specific needs of the patients, which means that the physician must indicate when and how long the medicine should be taken by the respective patients. So, prescriptive drugs may also be classified into 3, which are drug with prescription, regulated drugs, and prohibited drugs. These 3 categories will be further discussed and explained by Ms. Jehan Alindo.
Thank you, Mr. Lagas. Now, as we all know that prescription drugs are the drugs that are prescribed by the doctor. Let's proceed to the 3 classified of prescription drugs. First is the prescription drugs. It is a medicine that can only be made available to a patient on a written instruction of an authorized health professional. Examples of prescription medicines include blood pressure tablets, cancer medicine, and strong painkillers. Second is the regulated drugs. Now, regulated drugs is one that is researched, manufactured, distributed, and administered under the supervision of regulatory authorities and international agreements. This simply means establishing informal controls over the production, supply, and availability of drugs. Lastly, prohibited drugs. From the word itself, prohibited means illegal. It is forbidden by the law. Why? Because different illegal drugs have different effects on people, and these effects are influenced by many factors. This makes them unpredictable and dangerous, especially for young people. That's it for today. Thank you for listening.
Hey, everybody, I'm Desiree Jean. Today, we're going to dive into a topic that affects all of us at some point, over-the-counter drugs. Whether it's for a headache, a stuffy nose, or a cough, these medications play a crucial role in our lives. So, let's get started and explore the world of over-the-counter drugs together. The first thing you need to know about over-the-counter drugs is that they are easily accessible. Unlike prescription medications, you don't need a doctor's prescription to purchase them. This makes them incredibly convenient for those sudden ailments that catch us off guard. However, it's essential always to read and follow the instructions and recommended dosages provided on the packaging. Now, let's talk about the variety of over-the-counter drugs available. There's a whole range of options out there catering to various symptoms and conditions. From pain relievers like acetaminophen and ibuprofen to allergy medications, cough suppressants, and antacids, there's something for everyone. But remember, not all medications work the same way for everyone. It's crucial to understand your specific needs and consult a healthcare professional if you have any concerns. It's also important to be aware of any potential side effects that may come with over-the-counter drugs. While they are generally safe when used as directed, some people may experience adverse reactions or interactions with other medications they are taking. If you're unsure or have any pre-existing health conditions, consulting a pharmacist or healthcare provider is always a good idea.
Thank you, Ms. Baricuatro. Now moving to why OTCs must be used discriminately. First reason is to avoid dispensing of OTC drugs to known identified habitual drug users. These are those individuals who regularly uses drugs for self-medication or some other specific or particular reasons. Second is to avoid complications. This is done by inquiring from the buyer of the drug as to the identity of the patient's age, and other information such as whether the patient is pregnant, has hypertension, and more. Lastly, to avoid the self-medication syndrome. This is done by counseling the patient by inquiring about the buyer's source of information about the drug. How did he or she knew about this drug? Was it out from the prescription of the doctor for self-medication, or could be anything else?
Now that my fellow reporters discussed about drugs and drugs abuse, in order to understand more about it, I'm going to report the different dosages of it. The amount of a drug in a dose can be described as minimal dose, maximal dose, toxic dose, abusive dose, and lethal dose. The first one is the minimal dose. The minimal dose is the smallest amount of a drug required to achieve the desired therapeutic effect. Taking a low dose of pain medication to alleviate mild discomfort without causing adverse effect. The second one is the maximal dose. The maximal dose refers to the highest amount of a drug that can be administered to an individual without causing toxicity or harmful effects. Prescribing the maximum allowable dosage of an antibiotic to ensure effective treatment without risking adverse reactions. The third one is the toxic dose. The toxic dose is the quantity of a substance that results in adverse effects or toxicity in the body. Consuming an excessive amount of over-the-counter or OTC pain relievers leading to a liver damage due to the toxic effects of the drug. The fourth one is the abusive dose. The abusive dose is the quantity of a drug that exceeds therapeutic needs and may result in harmful side effects or abuse of the substance. Misusing prescription medications by taking doses higher than prescribed, leading to dependency or addiction. The last one is the lethal dose. The lethal dose is the amount of a substance that causes death. In cases of poisoning, ingesting a lethal dose of a toxic substance, such as certain chemicals or drugs, can result in fatal or lethal consequences. Understanding those categories is crucial for healthcare professionals to ensure effective and safe medication administration. This is Nicole Pulido reporting for the dosage of medications.
Thank you, Ms. Pulido, on your informative report about the prescribed amount of drugs. Now let's proceed to the common administration of drugs. First is the oral, the safest, most convenient, and economical route whenever possible. Oral drug administration involves taking medications by mouth. Examples include swallowing a pill, tablet, or liquid medicine, such as a cough syrup or capsule as prescribed by healthcare provider. The second one is the injection. It offers a faster response than the oral method. The third one is the inhalation, uses gaseous and volatile drugs which are inhaled and absorbed rapidly. The third one is the topical, application of drugs directly to a body site such as the skin. Examples are creams, ointments, and eye drops. The last one is the iontophoresis. It is the introduction of drugs into deeper layers of skin by the use of electric current. And that is all for the common drug administration. Let's hear from Ms. Kababat on her report about effects of drugs.
Hello everyone, I am Marina May A. Kababat, and let's tackle about the effects of drugs. The use of drugs can have a wide range of effects on the human body, and specific effects can vary depending on the type of drug, the dose, and the method of administration, and individual's psychological and physiological characteristics, and other factors. Here are some common effects that drugs can have. Allergic reactions. Some individuals may be allergic to certain drugs, leading to allergic reactions, which can range from mild skin rashes to severe anaphylactic shock. The second one is physical effects. Drugs can have various physical effects on the body. Stimulants, for example, can increase heart rate and blood pressure, while opioids can slow down respiratory function. Some drugs can also affect physical coordination and motor skills. The third one is overdose and toxic effects. Taking too much of a drug can lead to overdose, which can be life-threatening. Some drugs, such as opioids and certain prescription medication, are particularly associated with overdose risks. For the last one is psychological effects. Drug can alter an individual's mental state and mood. For example, some drugs can cause euphoria, relaxation, anxiety, or hallucinations. The psychological effects of drugs can be pleasurable or distressing depending on the drug and the individual. Thank you.